Greetings, everyone. This is Terry Naturally with another edition of Terry Talks Nutrition. Why? Well, because we're trying to improve the health of America. Everyone I talk to, everyone that comes on to the show, and everybody that listens, I hope we can make an impact on how you feel and to realize that you have every responsibility to improve your health. And I'm not just saying you. That goes for me too. No one can improve our health if we don't listen to anybody, if we get good advice but we don't do it. And there's a lot of science that proves that alternative health care, meaning natural products, the food we eat, the lifestyle we adopt, the choices we make are all part of our responsibility and will impact our health, good or bad. So now usually I spend a lot of time, well not too much time, but it takes away some of the time that we could talk about some of the very interesting topics that we should all learn from by me standing on my soapbox and giving you my opinions and my philosophy on how we can improve our health. Food is our medicine. And if we don't adopt a diet that is healthy as we possibly can obtain by knowledge, by budget, we're not all the same. We can't all buy the same quality of food. But when you buy with the intentions of doing your best, no matter what your budget is, and how you can make a meal for your family and yourself that'll give you the best opportunity to be healthy. And it's not so much what you eat that keeps you healthy. It's what you don't eat, what you do not eat, what you do not put in your food. What you do not put in your mouth is going to make you healthier. Stop eating the junk. Stop eating fast food garbage. Stop eating sugar. And stop eating so many refined and processed, ultra-processed foods and carbohydrates. Our body needs quality protein, quality fats. There are essential fatty acids that our body requires every day. We need essential amino acids from protein every day. There are no essential carbohydrates. If we eat protein and fats, we can make all the carbohydrates that we need. We can live without carbohydrates. But they taste good. And that's why people eat it. Because it tastes so good. And manufacturers know just how much sugar to put in food to addict us. We are being taken advantage of, and then we pay the price by experiencing bad health. And unless we make the changes and we adopt a better diet and adopt a better quality of sleep and exercise and just all those general things that make us healthier, we're going to have disease. We're going to have illnesses. We're going to have infections. We're going to be just unhealthy. And that is America. It doesn't take much to change. Oh yeah, a lot of discipline, a lot of sacrificing, and a lot of foods that maybe you just love because you just love the taste and they make you feel so good. But that's what manufacturers know, how to get under your skin and how to make you buy their food over and over and over again, even though that you know it's bad for you. You got to stop that. If you want good health, there's things you can do, and only you, But that's why we're here. We're trying to help you understand how to make better choices. So we have a really good roundup of topics today. We're going to talk about bacterial infection and how to lift weights to sleep better. And then the herb of the day is called sea buckthorn. That's not like vitamin C. It's SEA, sea buckthorn. And we'll talk about a virus outbreak. And you are not too old, you're not too young to have colon cancer. It's being found in younger and younger people today. And then, are you anxious? Well, we have a whole new generation of Xanax. And 2 studies on how to help MS, multiple sclerosis. And then let's take a closer look at triglycerides. Very interesting subject. It's not cholesterol that's your problem. It's triglycerides. And we can lower our triglycerides much, much easier. And I don't want to lower my cholesterol. I like it where it is. A little bit on the high side. That's exactly where it should be. And I don't even worry about cholesterol. But so many people worry about it that they have side effects of using drugs to lower it. So let's talk about bacterial infections. Bacteria is alive. It's a live bug. They are free living cells that can exist inside and outside the human body. You can pick up bacteria from different surfaces or from different people. And if that harmful bacteria that you pick up, wherever it is, can settle into the body, they can replicate. Another word for grow. And kill cells and tissues or generate toxins that destroy cells. Bacteria, bad bacteria. We're not talking about the good bacteria. We're talking about the bad bacteria. And they're everywhere. But we have an immune system that can fight back if it's healthy. And not all bacteria are bad. Good bacteria living in our intestines plays a huge, important role in normal digestive function. But there are very common illnesses caused by bacteria. And that includes urinary tract infections, food poisoning. We pick up bacteria from food, skin infections, cellulitis, some types of pneumonia, and respiratory and ear infections, all caused by bacteria. And the problem is that we have antibiotic resistance. Every year, over 2.8 million people get sick, and 35,000 people die every year from antibiotic-resistant infections. That means the bacteria that we may take, antibacteria that we may take as a drug, is no longer able to kill off the bacteria. The bacteria have become resistant to the drugs. The bacteria have become smart, and they want to survive. And every time they are bombarded with an antibiotic, they get stronger and stronger. So antibiotic resistance means that harmful bacteria are now immune to commonly prescribed drugs that previously was used to kill them off. These bacteria are also known as superbugs. Like Superman. You can't kill them off. So some of these bacteria, like MRSA, MRSA, is a commonly experienced resistant bacterial infection. And most of it is contracted in a hospital. If you go into the hospital, more than likely you might get MRSA, MRSA. You know, it's a hotbed for bacteria. There are sick people in hospitals. They have infections, bacterial infections, and are often acquired in the hospital while being treated for a different health problem. Can you get that? So if you can manage it, stay out of the hospital. Now, I'm not saying don't go to the hospital when you need it. It's probably a better place than not. But you know that you want to have a strong immune system, but probably do not because you wouldn't have other health problems. But you've got to stay healthier. Avoid the hospital. And this bacteria MRSA infection often affects older adults, and mortality rates, death rates, can be as high as 30%. Now, what are some of the natures? What are nature's antibiotics? There are many natural compounds, herbal compounds, that are very, very powerful. And they are called nature's antibiotics. And you can buy them, or a combination of them, in health food stores, or maybe other stores as well. Now, here are some of the most powerful natural antibiotics that do not cause additional harm and kill off bacteria even more effectively than prescribed drugs. Cinnamon oil. Actually, when cinnamon oil was tested against drug-resistant bacteria, including E. coli, cinnamon oil had greater potency than 3 commonly prescribed antibiotics, 3 commonly prescribed drugs. Now, when combined with antibiotics, you can combine them. If you're on an antibiotic, cinnamon oil increased the drug by 8 times. So if you're taking a prescribed antibiotic and you also take cinnamon oil, it increased the effectiveness of the drug by 8 times, 800%. Now there are a couple of others that are natural antibiotics that do not cause side effects. And one is thyme oil, Thyme, the herb thyme, and oregano were found effective. Now listen to this, folks. These 2 natural oils, thyme and oregano, were found effective against 15 different strains of harmful bacteria, including E. coli, 16 strains of yeast infection, including Candida albicans. In a test evaluating the antibacterial effects of 6 different plant essential oils against 25 different bacteria, the most effective were thyme, oregano, and clove oil. I like a combination. And when I travel, you travel to different countries in the world. Just recently I went to Vienna, Austria. I went to Slovakia. So you're traveling on planes. You don't know who in the plane has a bacterial infection or could require an antibiotic for a variety of infections, but they're still traveling. They're on their drug, which is not necessarily helpful or effective. So many bugs cannot be killed off with what we prescribe today by physicians to kill off the bacteria. So I like to take a combination of cinnamon oil, thyme oil, clove, and oregano. About 75 milligrams of this combination 2-3 times daily. Commonly, I take a soft gel capsule of these 4 very powerful plant oils. And I like to chew the soft gel because, first of all, we have more bacteria in our mouth, bad bacteria in our mouth, than anywhere else in the body. And if that bacteria gets into the bloodstream from the mouth, it is one of the most major causes of heart disease. And think of how we may have just sat next to someone in the plane that has an infection. They're not going to tell us. They're not going to tell the flight attendant, oh, I have an infection. They're just going to a meeting. They're just going, hey, I'm going on a trip, and I'm not going to delay it because I got to get out of here. I got so much stress. I don't care if I have an infection or not. I'm going. So there are people that are not well sitting next to you. So how are you going to take care of yourself? Well, I'm not going to take an antibiotic from a doctor. I haven't done that in I don't know when. So I'm going to take the combination cinnamon, thyme, clove, and oregano oil, about 75 milligrams in a soft gel capsule, and I may do that 2 or 3 or 4 times a day. So if I think I'm coming down with something, maybe you get a little bit of a sensation that, I just don't feel right today. So then I may up it. Normally 1 a day is fine, but when I think something's not right, maybe I ate some bad food. There are different foods around the world, and I'm traveling around the world. Even at home, sometimes we don't know where bacteria is. It can be everywhere. We're in a soup of bacteria. And only our healthy body and our healthy immune system can delay infection or fight infection or kill off the infection. But we have to be prepared to do that. And I know I don't want to take a prescribed antibiotic. Most times they don't work, or you have to take 2 or 3 or 4 times. When I take my combination of cinnamon, thyme, clove, and oregano, I swear by it. It works all the time. So, lifting weights to sleep better. Here's what some researchers found. They looked at sleep and exercise data from over 2,000 people that were at least 60 years old or older. They found that strengthening exercises, resistant exercises, called resistant training, using weights or bands, improve sleep quality better than aerobic exercise or no exercise. Weight training. Don't think you're going to be a bodybuilder. But we need to make our muscles stronger. And when we carry weight, our bodies get stronger. Or if we lift weights, our body gets stronger. If you put two equally, boy, my dyslexia is really popping up today. You carry 2 equal weights, like 20 pounds each, 1 in each hand, 1 in the other hand. So you have 20 pounds in your left hand, 20 pounds in your right hand, and you walk a distance. Now, I'm not saying 20 pounds is the right weight for you. It depends on how well you are fit and how far you're going to walk. But if you just walk 50 feet, carrying weights is called the farmer's walk. It's like carrying 2 milk cans, 1 in each hand. So if you can carry 5 pounds in each hand, or 25 pounds in each hand. Probably 25 is a good weight for most people. And you hang those weights straight down. You hold them in your hands. Your shoulders are back. Your arms are straightened out. And you walk. Some strength exercises, judged by experts in training exercises, feel that carrying weights, because that represents how you live. We carry weights all the time. We go in and get groceries. We pick up a bag of dog food. All that is weight. And if we walk with weight, that means our body gets stronger in every muscle in the body. Your legs, your back, your shoulders, your arms. Carrying weights is a very, very powerful way to build health in your body, to build strength in your body. You don't become a bodybuilder. You're not going to have big muscles. You're not going to look unusual, but you're going to be stronger. And you can also do the kettlebell swing and carry one kettlebell in each hand when you're doing the walks. We're getting stronger rather than aerobic exercise. In fact, in a previously published study of over 20,000 German men and women, any muscle training exercise was associated with improved sleep. And for more help to have a better night's sleep, what I would recommend for a natural, healthy sleep cycle is to try melatonin. 5 to 15 milligrams at dusk. And why I say dusk, that's the time our gland in the brain, the pineal gland in the brain, releases its natural melatonin. Not an hour before bedtime. A lot of labels on melatonin products say take an hour before bedtime. When we start to see it's getting dark and it's at dusk, the sun is going down, that's when the pineal gland releases melatonin in preparation for a good night's sleep. Not an hour before bedtime. If you go to bed at midnight, taking an hour at 11 o'clock is not going to have much effect because you missed several hours of the melatonin cycle. And this will help reset your natural sleep cycle. You can also take a natural form, and as I've talked about plant oils, this is another area of using plant oils, concentrated plant oils. And the best combination I know, after much research by medical experts on plant oils, they recommend 125 to 250 milligrams of concentrated plant oils. Now this, about an hour before bed, because there is no normal release of plant oils in the body. So, mandarin orange, lemon balm, ravensara, and lavender can ease your anxiety, ease your stress, and relieve insomnia. And if stress is a real problem, I recommend ashwagandha. It's an Indian herb spelled ashwgandha, ashwagandha. It's similar to ginseng. There's no ginseng growing in India. The main stress relieving, energy boosting, and just overall strengthening the body is ashwagandha or echinacea angustifolia. Now don't confuse echinacea that is commonly used for cold and flu and building up the immune system. Yes, echinacea does that. But there are compounds in echinacea called polysaccharides. And these polysaccharides build and support your immune system for when you need it most. But there is a group of compounds in Echinacea angustifolia called alkamides. And these alkamides are very powerful for reducing stress. So I just glanced at the clock, friends, and I've got to pause here for a few moments. So don't go away. I'm going to be right back, right here on Terry Talks Nutrition. I'm Terry Naturally. More on ashwagandha and echinacea right after this. And welcome back, my friends. Thank you for joining us again for the second portion of our program. Thank you for staying with us. And if you have to go off and do something else, come on back next week and the week after, and we have a lot more information coming your way. Now, we were just talking about stress, more serious stress. For sleeping, concentrated plant oils, mandarin orange oil, lemon balm oil, raven sarra oil, and lavender oil to ease anxiety and relieve insomnia, and it can also reduce stress. But if you have a major stress problem, ashwagandha and echinacea. Now, the reason I was talking about echinacea is because it's commonly used to build the immune system, to support the immune system, to stop cold and flu. But why would you use it to relieve stress? Because plants contain hundreds and hundreds, if not thousands, of molecules. A drug is just one molecule. It does just one thing. Plants have thousands of molecules that can do a variety of conditions and affect dozens of indications because there are many, many different molecules. And there's a group of compounds in Echinacea angustifolia, not known as polysaccharides, that stop cold and flu and boost the immune system, but also these are alkamides that affect the brain to reduce stress. So if you're using ashwagandha or Echinacea angustifolia that is indicated from alkamides, 150 to 300 milligrams of ashwagandha daily, and these compounds in ashwagandha are standardized to 35% with enolides, glycosides. That means it's water soluble. So it's very easily to be absorbed and quickly becomes effective because there is no inhibiting it from being absorbed systemically. It reduces cortisol, the stress hormone that's produced in the adrenal glands. When we have stress, the hormone cortisol skyrockets. And we have all kinds of stress indications. We have binge eating, trying to control it. We gain weight because of the stress. Because eating makes us feel better. But you don't have to eat to feel better in this case. That's what the Echinacea angustifolia will do for you. And the ashwagandha. And it improves sleep by over 50%. You will sleep so well. I like a combination of melatonin and either ashwagandha or Echinacea angustifolia before bedtime, at dusk, so they work together. Now, Echinacea angustifolia can be taken during the day or at night, and it has been shown to quickly relieve stress and take about 40 to 80 milligrams when needed. And this relieves your stress within about an hour. If you have to fly on a plane or give a lecture or report to the president of the company or your supervisor something that makes you stressed out. Anything that causes stress. Then take the echinacea and angustifolia, and you could also add the ashwagandha if you want. What a really good combination. Perfect combination for reducing stress, but improving energy levels. So this is really a good way to ensure your body has the best results. Now, have you ever heard of sea buckthorn? Sea buckthorn is a berry. It's a fruit. And sea buckthorn is so special. And that's S-E-A, not vitamin C, not a sea buckthorn, but a sea, water. C-E-A, sea buckthorn. And it's very special for a number of reasons. After all the research on these berries, and they're primarily grown in the Himalayas, China, and some are grown in India. The berries contain over 200 beneficial compounds, including omega fatty acids, especially omega-7. Vitamin E, vitamin C, beta-carotene, plant sterols, minerals, 60 different antioxidants. The omega fatty acids in sea buckthorn are sometimes called the beauty omegas. Why do they call them the beauty omegas? Because they do a number of things for the health of your skin and mucous membranes. This type of omega-7 increases collagen production, heals the skin, increases skin brightness and elasticity. It hydrates the mucous membranes. The mucous membranes are wet surfaces in your body. The intestinal tract, the colon, the vagina, the mouth. If you touch those membranes, they're wet. Now there is one membrane, one mucous membrane, that is not wet. And that is the skin. The skin is a huge mucous membrane. And when it dries out, we need to hydrate it, but also we need to take omega-7 to moisturize the skin. Up to 48% moisturize by taking sea buckthorn compounds in a soft gel capsule. It also moisturizes the eyes. If you have dry eyes, sea buckthorn will moisturize the eyes. Now here's a point to remember. Sea buckthorn just restores moisture. In a clinical study of 100 people with dry eyes, 4 soft gel capsules of 500 milligrams of sea buckthorn daily significantly relieved dry eye symptoms, including redness and burning. Now you can use this for dry mouth. I know a lot of people that have had chemotherapy. Now their mouth is dried out all the time. I know some people that walk around with a bottle of water because they are so dry all the time. So you can use it for dry mouth, dry eyes, Sjögren's syndrome, which is an arthritic type of syndrome, peptic ulcers, irritated, itchy skin, dry skin, and treating and preventing wrinkles, dryness, and other symptoms of prematurely aging skin. Menopausal symptoms, menopausal problems, including dry vaginal tissue. Any health condition involving inflammation, especially involving the mucous membranes, and also improves heart function as well. This is a very powerful, as I said, it contains over 200 powerful nutrients. I have not found a berry or any food that contains so many natural compounds for the health of the body. Now, how much do you take and what to look for? For basic health maintenance, you don't have any of these conditions. Say, take 500 milligrams daily of sea buckthorn oil. 500 milligrams daily. The treatment dosage can be anywhere from 4 to 6 soft gel capsules daily. And look for sea buckthorn oil from the berry as a supercritical CO2 extract. That means they use carbon dioxide to extract the oil from the berry. And that means there are no heavy metals, no contaminants, nothing but good, natural omega-7 fatty acid. And make sure they're hand harvested. Very, very difficult to harvest the fruit, the berries. They are grown on trees, bushes that have huge thorns. So it's difficult to pick. Some very, I guess I would call them not environmentally friendly. They cut off the branches from the tree. They freeze the berries on the branches, and then they whack them on a hard surface, knocking the berries off the branches. Not environmentally friendly. So the hand harvesting costs more in labor, but you know you're getting a very good quality berry. Now you can take 150 milligrams of omega-7 per capsule in each of the 500 milligram soft gel capsules. And the capsules can be chewed. If you have a problem in your mouth, and the oil can be swished in the mouth, the taste is relatively mild, and it's bathing the mouth tissues, the mucous membranes in the mouth, directly, which can be very helpful for certain oral conditions. Now, what about virus outbreaks? We talked about bacterial outbreaks, bacterial infections. What about viral infection? That was COVID-19, viral infection, upper respiratory tract infection, the number one infection in the world. Very common in kids. Most infection is upper respiratory tract infection, sinus infection, bronchial infection, lung infection. So now here's some more news on the norovirus. 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 Multiple areas of the country is experiencing norovirus outbreaks over this past winter. Norovirus is a highly contagious viral infection that causes cramps, diarrhea, vomiting, fever, dizziness, and fatigue. Norovirus spreads easily, and it's so contagious, and it can live for days on hard surfaces, and can also spread through contaminated food, and a infected person can continue shedding the virus. That means contagious to other people for up to 2 weeks. 2 weeks after they have started to recover. It can spread across the country. Now, there are 2 natural ingredients that can stop norovirus. And they are propolis and lactoferrin. And both of these natural compounds have no side effects, no adverse events, and they're very powerful, what we refer to as multi-antimicrobial. So that kills all kinds of, we're talking about norovirus, but all kinds of pathogens. Fungal infection, bacterial infection. So propolis and lactoferrin can work on every form of infection. And both have been shown to block it from attaching to intestinal cells and stop it from replicating, growing, multiplying. Now take a combination of lactoferrin and propolis, 75 milligrams each. That's a good dosage. Daily to keep the immune system strong. If you are having a problem, you already have the norovirus, and you're not feeling well, you can take the same combination, lactoferrin and propolis, 75 milligrams each, combined in a capsule, to keep the immune system strong and healthy. And you might want to do this 3-4 times a day. Every 3 or 4 hours, take one. You might do that for a week or two to really kill off any infection and destroy the pathogen, and in tune build up the immune system, to strengthen the immune system. Now, unfortunately, younger people today are being diagnosed with colon cancer. Years ago, it was found in a lot of people that were quite older, the elderly. But now young people in their 30s and 40s are being diagnosed with colon cancer. What's up? Yes, even young people today are getting colon cancer. Over 100,000 people will be diagnosed with colon cancer this year. Colon cancer rates in people under the age of 50 have doubled since 1995. Have doubled for people under the age of 50. And here are some symptoms that you should not ignore, no matter your age. Constant abdominal pain, fatigue, feeling like you are always tired or weak, blood in your stool, or any lasting change in bowel habits. Even reoccurring constipation or diarrhea can be a symptom of colon cancer. So how do we stop or prevent colon cancer? One of the most powerful natural medicines to treat colon cancer is curcumin. Curcumin has a triple effect against colon cancer. And curcumin, as we always have suspected, is very difficult to be absorbed systemically. So a lot of it that is ingested and consumed stays in the colon. So it has direct contact with the cells in the colon and has a greater impact because of that. So this triple effect against colon cancer protects against cancer cell formation in the colon, prevents cancer progression, the growth of it, the replication of it, causes colon cancer cells to self-destruct. Curcumin makes conventional cancer drugs more effective. There are so many doctors that will not allow their patient to take any natural product. That's crazy. There's so much research that shows natural products like curcumin, like andrographis, like grapeseed extract, like aronia berry extract. These natural components have been shown in clinical studies, clinical trials, scientific studies, to show that They work as effectively as chemotherapy. And if a person is on chemotherapy, the natural substance like curcumin makes the drug, the chemo drug, more effective, including cancer cells that are resistant to drug treatment. This means less of the toxic cancer drug is needed for its effectiveness, for its beneficial effects. There is less risk of adverse effects or cancer reoccurrence or side effects if they are taking curcumin or any of the other natural compounds I mentioned with the drug. Doctors don't know curcumin. They don't know these natural products. So they're afraid of them. They won't let their patient take these natural products when these natural products can make the drug more effective at a lesser dosage and far less toxicity because you're using a lesser dosage. Anyone in my family that would have a need for chemotherapy, I would naturally put them on curcumin and antigraphis and melatonin and aronia berry and grapeseed extract. To also consider these other natural alternatives like antigraphis, grapeseed extract, aronia berry. Both reduce colon cancer, all reduce colon cancer, but the combination reduce tumor size. This was an animal study of colon cancer using human tumor cells. And it reduced the tumor size within 21 days, 3 weeks, by almost 90% in the test conducted by cancer researcher Dr. Ajay Goyal. He heads up the Cancer Research Center at City of Hope Hospital in Los Angeles. Also, you might want to stop in your health food store and see if they carry Dr. Ajay Goyal's book. It's an excellent book to read if some member of your family has cancer or you want to learn how to prevent any case of cancer. Read his book, How to Cure Cancer with Natural Alternatives. Now there's a whole new generation of Xanax. Benzodiazepines are some of the most commonly prescribed psychiatric drugs. 86 million prescriptions were written last year. This class of drug includes Xanax, Valium, and others, usually prescribed for anxiety or sleep problems. Long-term use is not recommended. Yet 25% of patients taking these drugs have been on these medications for 4 or more years. Stop using can be very difficult. Up to 44% of users experience moderate to severe withdrawal symptoms, including additional anxiety, that is worse than when they started the medication. A smaller group, up to 15% of patients, experience withdrawal symptoms that lasted 4 months or more, and actually for years, including extreme anxiety, agitation that makes sitting still impossible, heart palpitations, memory loss, intense physical pain, nausea. For some patients, the withdrawal symptoms are so bad they ultimately take their own life. Drugs, killing people. Anxiety relief without adverse effects. There are many natural medicines that can help with mental health. Echinacea, that is standardized for the alchemites, for quick relief of anxiety. Curcumin, alone or in combination with saffron, for depression. And curcumin was as effective as Prozac. St. John's wort, one of the most critically studied natural medicines for mild to moderate depression. Ashwagandha for anxiety and stress relief. Red ginseng for relief of stress. And a new study shows benefits for mood. Rhodiola, Greek mountain tea, PEA, omega-3 fatty acids. All of these and many more can all be tried before taking Xanax or Valium. Get off these drugs. Benzodiazepines. Caution. Talk to your doctor. You make your own decisions. I'm not telling you to go off drugs. I'm not telling you don't use the drugs. I'm telling you that you are facing a consequences that may be too major to change. All these natural products can be highly successful with or without drugs. So that, my friends, hour has gone by so fast, too fast. So I must leave. I'll be back again, same time, same station. I'll be back here again and again and again. We need to share information to make the country healthy again. So God bless you, my friends. God bless this great country.
Thank you for listening to Terry Talks Nutrition Weekly Show. Don't forget to subscribe and leave a review on your favorite podcast platform, including Apple, Google, and iHeartRadio.